presentations we've done, we do convenings, and other local programs. So I want to frame the discussion today in terms of how our cities and neighborhoods and buildings are designed and how that has an impact on public health. But I first wanted to link health back to happiness, since that's the main theme of this conference. So we know there are many factors that can impact happiness: genetics, life circumstances, just your general mindset. There are also environmental factors that have impacts on stress levels. There's also social isolation from auto-dependent communities, which impacts the elderly, kids, people with lower incomes who may not be able to afford a car. So the focus on designing and building to move cars rather than people contributes to high rates of pedestrian bike injuries from motor vehicles, low rates of physical activity due to spending a lot of time in a car, and also due to not having the right infrastructure to promote physical activity. Rates of injury and death for pedestrians and bicyclists are increased along roadways without sidewalks, but can be reduced with the installation of traffic calming elements such as medians or protected bike lanes or sidewalks. And transit inherently has a physical activity component that people don't really think about because you have to walk to the bus or the train. The transit also requires a certain amount of density in order to support it. And this chart, I don't know if you can see, it just shows that countries that have low rates of obesity have high rates of commuting through walking or biking. And not surprisingly, the US has very low rates of alternate commuting and high rates of obesity, which can be correlated to the way that our transportation and infrastructure has developed in this country. And land use patterns also have impacts. In the US, we've developed our land differently than in other countries that have resulted in some negative environmental and economic and social impacts. Low density and sprawling development with a separation of land uses has had impacts on chronic disease. Parks and open space can improve public health and environmental health, and it's often up to the public sector to ensure the proper placement and programming and size of these parks. Parks, trails, and green space have positive impacts on stress, physical activity, social capital, even hospital patient recovery time. And just the way that neighborhoods are designed, especially in suburbs, grid patterns provide many more options to easily access schools or shopping centers than a neighborhood with a million cul-de-sacs does. If there are shorter paths to access these places, so in picture B, where there are probably like 7 or 8 different ways you could get to the shopping center, as well as a feeling of safety while getting there, people may choose to walk or bike rather than drive. And a lot of what I think the role of planners and developers and designers and policymakers is when it comes to creating healthier cities is ensuring that people are able to make choices and make it easy for people to make the healthy choice. choices such as walking to work versus taking transit or driving. Choices such as eating junk food versus eating a well-balanced, healthy meal. Choices such as living in a city or a neighborhood with a lot of social interaction versus living somewhere that's isolating. So the fact is that professions like policymakers, planners, landscape architects, real estate developers, and architects, people that have a direct impact on how our cities and neighborhoods and buildings are designed, are now considered a new type of health professional. Richard Jackson, who is a physician and health professional, who's one of the leading advocates and researchers in this movement, has said, "We now know that developers can be more effective in achieving public health than doctors in white coats." So this is based on research that links our built environment to health outcomes. More effective than doctors. That's a pretty big statement. So hopefully by now, I've convinced you that land use can have a big impact on health, both positively and negatively, and that land use professionals and policymakers have both helped cause this and can help reverse this. According to Richard Jackson, this is our charge. But what exactly can we do? So policymakers can support policies such as inclusionary zoning, which helps increase the stock of affordable housing in cities, mixed-use development. Health in all policies is a new approach that's been embraced by the health field as a way to achieve health equity in all types of policies. And this approach has also been promoted by the American Public Health Association and is defined as a strategy for addressing the complex factors that influence health and equity. So health in all policies is seeing a lot of big pushes from health departments. Planners had things that he incorporated into this project were redesigned exterior staircases, a saltwater pool, and a roof deck and courtyard, and a community garden that he found that his residents really liked having access to the food and the produce, but they didn't want anything to do with maintaining it, so he hired a gardener to do that, and it's one of the most popular amenities of this project. It's also the first multifamily building in the state of Arkansas to achieve LEED certification, and it's certified LEED Platinum. And one thing that Jeremy has said is that when he was developing this project a few years ago, it was really challenging working with contractors who didn't really have experience or knowledge of healthier building materials and non-traditional building materials. So it really underscores the importance of increasing the knowledge base across the board on linkages between health and the design of our buildings and communities. So an example of a small planned community that employs a lot of the recommendations from the toolkit is the West Village at the University of California at Davis. It's incredibly sustainable. It's the largest Plan Zero net energy community in the US, but it also incorporates paths and parks in order to increase walking and biking. It consolidated parking along one edge of the site, so you can't really park right next to your front door. You have to actually walk across a courtyard. All the apartments are accessed via these internal sidewalks. It also includes more traditional fitness amenities like a gym and a pool and sports courts. And then a couple projects closer to home. In Pittsburgh, this is a mixed income housing, office, and bicycle promoting historic preservation project called the Century Building. This building opened in 2009 and was the first affordable housing built in downtown Pittsburgh. The use of non-toxic materials and a non-smoking policy has actually improved the allergies and asthma of the tenants. They've reported to the building developer their conditions have actually improved by living there. The building also strongly promotes bicycle usage. You can see they even painted a huge bike on the side of the building. They have an on-site bicycle commuter center that they constructed out of recycled shipping containers, which is pretty cool. Half of the 49 bike parking spaces in that commuter center are used by residents, and then the other half are available to the office tenants or other city commuters for $125 a year. And then in Philadelphia, the new headquarters for the healthcare company GlaxoSmithKline has an open office workspace. It includes treadmill desks and standing desks. Prominent staircase in the lobby encourages employees to skip the elevator. That's one thing I think that, a lot of buildings that are being built these days just have elevators and you have no idea where the stairs are, unlike buildings that were built, however many years ago. So people just naturally gravitate to the elevator because it's the easiest thing, but by making staircases more visible and sort of hiding the elevators, people might not immediately go try to find them, especially if you're only going up a couple floors. There are other amenities in the project too, including a gym, walking trails on site, a bike sharing program, and a health clinic that all really support the company's mission to make wellness a priority for their employees. So just looking ahead, there are a lot of things that policymakers and developers, planners, and designers can do when it comes to creating healthier places. So there are 21 recommendations that can be implemented in all projects, but we also encourage everyone to sort of take it to the next level when it comes to improving health. Forming new partnerships with non-traditional partners. Our professional fields have become sort of siloed. Planners may not think to work with health professionals, architects may not think to work with health professionals, but land use professionals, health professionals, universities, we can all work together. We need people across all disciplines to help implement these strategies that work for health. And by leveraging these partnerships, we can collectively facilitate efforts to forge a deeper understanding of community health needs, measure health outcomes, which is a really difficult thing to do, and grow the body of evidence about what actually works to improve health. Health professionals can be used as a resource for ensuring that health is included and measured correctly. And use language that reinforces health, wellness, and well-being when marketing projects or when creating new plans or policies. And just remember, in everything that you do in your business and every decision that you make about your work and in decisions that you make in your personal life, think about how you can make the healthy choice the easy choice and also the visible and the accessible choice. You can lead by example in the home or in the workplace. So just in closing, regardless of income or educational or ethnic background, all people should have
My concern is, to what degree is that the norm or the exception in gentrification plans? Are those sorts of things? Is that like a growing trend, or are they sort of like this new thing that has cropped up and everyone's sort of trying to feel their way out as to whether they want to go into doing things like that or not, or is there no data to say one way or the other?
So that's very interesting. So actually, one of my first thoughts with this, with eco in particular, because it was the redevelopment of an existing apartment complex, was what happened to the people that were living there before. Because I think, that happens a lot. Fortunately, in this case, which I'm glad about because I love this project, it was vacant. Um, or the people, I forget, their leases expired, so like nobody was impacted. But I think that is a concern. You have these older buildings that are in desperate need of rehab, but people are living there. So what do you do with the people in the meantime?
Yep.
There's a project actually, like right next door to where I live, that is an affordable housing project. They're losing their Section 8 voucher status because I guess it expired, and they want to rehab the building, and so all the people have to leave. I think it's tricky. I don't know. There might be some data. I'm not familiar if there's a lot of data, but I mean, it's definitely a concern. I think gentrification it's a huge problem, and I think that there are people, people that need some of these things the most don't want them to come in because they're afraid that they're going to be pushed out. I think that's where more affordable housing policies can really help, but then that's a really slow thing too. So I don't think there's an easy answer to choose. Yeah.
I'd like to add to that.
Yeah.
When the gentleman spoke about, and that is a real concern, it goes beyond just them losing their Section 8 or them having to find affordable housing. These are viable systems that are in place.
Yes.
Where these people interact or communities
Yeah.
in themselves.
Yeah.
So when you break up and fracture, I'm a social worker, by the way, and I already have a social science degree. When you fracture that community, you invite all kinds of things in. So gentrification is underway because Americans are moving from the suburbs. It's happening in York, it's happening in Lancaster, it's happening in Baltimore. They're moving into these nice older homes, and these neighborhoods are being broke up. That is something that has to be addressed, because when you put that imbalance in the system, it invites crime, higher drug use, and talk about psychological stress. Those people they're put in places where they don't know anybody,
Right.
where they don't know how to access services.
Yeah.
So, albeit they do need to be rehabilitated, but more
can do is go around the country and like talk about these awesome projects for right now, but I think hopefully at some point, yeah.
The other thing I mean, as I was sitting here, I know in our area, you asked about our area, and unfortunately, because of family members, I spent a lot of time in hospitals. And I noticed a phenomena of the workers there often seem, the surgeons seem really healthy. The doctors tend to seem healthy, but I noticed
efficient if I could just
Yeah,
hop
hop
on
on
a
the
light,
train,
park,
yeah.
jump on the train. But it seems that it's, I guess it's a larger government problem. They're the only ones who can afford to do it.
Nobody wants to pay for it, I think is a
Yeah.
huge problem, yeah.
So,
Even, like, so I lived in Austin for 12 years, which is a pretty big city, and they, for the majority of the time I lived there, only had a bus, and it was crappy, and nobody ever wanted to ride it, and so then the highways would get really clogged, and then people would complain about that, like, there's so much traffic, people need to stop moving here. It's like, no, you just need to stop voting down light rail. Like, you have the density, you actually in Austin have the density to support it, and they eventually put in one that, like, goes nowhere. It's like on the existing rail track, and they put in, like, it wasn't even a light rail, it was like a commuter rail, but it didn't go anywhere, so people don't really take it, and it's not really solving the problem.
So then they say it failed.
Right. Yeah. And then they don't want to pay for one that might actually work. It's incredible.
and another question I have, green roofs. I recently saw something, I believe on 2020 or something, planted grass roofs.
Mhm.
Um,
Yeah.
Yeah, well, Lancaster is the stormwater project. We're one of like the top in the nation for management of stormwater, and they've put a bunch of like sustainability projects in the last couple of years. We got grants to do that. It's all about like it's adding more green space to urban areas to absorb the stormwater and using like impervious concrete and those types of things.
Some
Yeah.
of them can be even spaces you can walk on.
Yeah, they're actually building, they're actually working on a program where I live in Lancaster City, where homeowners will have the opportunity to potentially receive tax breaks if they would implement some sort of similar project to that, like a green roof or a water barrel or those types of things. So, because we can't manage our stormwater, we don't have the infrastructure to manage it, so we're looking for other ways to gather it, and
Yeah.
green roofs is one of those
I think it helps
methods.
cool, like, keep your buildings cooler or something too.
yeah, I saw
Mhm.
something about that where people were growing grass on the roof.
Yeah. There's
Yeah.
some city in Germany, like, that's been, like, I think for years and years they've been doing it, Stuttgart or something. It's just like, if you look at an aerial view, it's like everywhere is a greener.
That's cool.
But people have to
I have a flat roof.
You can do it.
I can. So speaking of actually, so Lancaster City. I mean, the majority of the buildings in downtown Lancaster are over 100 years old. Some of them are 300 years old. So what can homeowners and building owners of these types of buildings do? Like, what would be like the first step to trying to make our homes and these old buildings healthier?
I am not a historic preservation expert or an
Okay.
architect. I mean, I guess, like, if it's in good enough shape and can just be, like, rehabilitated, I would probably do something to focus on, like, making sure your indoor air brought in like several people to sort of talk about you know, our experiences with mental health in the built environment, and it was hard for all of us to sort of find research that makes connections. So I think it's still sort of, people get like the physical activity connections. I think the mental health part is still a little less talked about. So that's really, I didn't know that about the American Psychological Association, so I'm gonna have to look into that. Yep.
I'm glad that you brought that up because there was something that I was thinking about as we were going along. As this summer showed us, it's a bit difficult to get comprehensive infrastructure legislation or appropriations passed through Congress, just like anything else. So what I was wondering is, for either federal or local governments, do they provide any incentives to urban planners to create these, you know, bike lane style roads or these healthy roads, and vice versa? What sort of tactics do the urban planners use to try to coerce or convince these either grassroots or larger governmental organizations that this is a good thing? Like, what's the sort of give and take there?
So I think there is funding that kind of filters down from the federal government. I don't know a lot about like funding for all these things, but there is funding like for complete streets and stuff like that. But I think it's filtered down into cities that they can use to actually, you know, they're doing infrastructure improvements, put in sidewalks. I think there are some cities that are requiring like, if you have to, if you know a road gets redone, like you automatically are putting in at least like a sidewalk, like maybe a bike lane, depending. And I think that there are also cities that are requiring, when developers come in to do new projects, that they put in, you know, they at least put in like the basic infrastructure as well. So I think, you know, cities may not be, I mean, I'm not even 100% aware of what I'm talking about with funding. I feel like there are all of these like different funding pockets that people just don't know exist, and they don't know that they can leverage them. Because there's not just this one giant like pot of money that's like, use me to improve your neighborhood. So I think it takes, you know, it's going to take a city to be like really, you know, diligent about looking for what they could actually use. Like, are there tax incentives from the government to do this kind of stuff? I was actually looking for that. We're working on a project on corridor redevelopment. So like that picture I showed, like that crowd, that's actually Knoxville, I think. It's like, how do we turn those places into healthier places? And we've had a lot of questions on like, what are my funding sources? And I tried to find, I was like, there's gotta be some sort of government website that just like lists every sort of thing that they'll fund, right? And I couldn't find anything. I think they hide their money. Like, this might be available. We're not gonna make it easy for you to find it though. But I think there is money for like, if you're doing like a complete streets type of project for transportation improvements that cities can get.
The reason why I ask is, over the summer I actually lived down in Columbia Heights, and they had bike lanes everywhere.
Yeah.
And coming from, you know, rural Pennsylvania, that was so unheard of. So whenever I saw the bike lanes out, part of me would always think like, I wish that we had these sorts of things around here, because I used to love to drive, but
Me too.
and I always, whenever I have this conversation, I always joke about the gas prices, but and the reality is, it's just a matter of driving in Lancaster sucks. I mean, there's no sugarcoating it. It does. So I would.
Where?
What's that?
Compared to where?
I'm from Reading, so
Oh,
I mean,
I
there's
see, okay.
nobody lives in Reading, so that's.
I mean, compared to like Baltimore, DC, Philadelphia.
Well, that's what I was getting to. Is that, I mean, DC still, the congestion there is atrocious.
It took me an hour to get out of DC on Tuesday. An hour, and I had to go 3
It's
miles.
wild. So I would just, it's just me sort of musing out loud that it would be really something to see if we could get bike lanes in these new roads, but
Yeah, I
who
mean,
knows if that'll happen.
like DC, for example, is like they really want like a good bike network, and we've got like there are some streets that actually have protected bike lanes, and you know a lot of them are like the road share, but you know they're trying to be pretty diligent about like creating a good network for bikes. So I think the city has to want to do it.
Yep.
I keep having this idea that like we should just increase the gas tax by like a cent. Like, don't tell anybody.
$1.
Tyranny.
Like, think about how much money you would have to like spend on alternative transportation. I can't see how that would be illegal, but maybe it would be.
What's your opinion